Welcome to the Cabral Concept, where board-certified Doctor of Naturopathy, Dr. Stephen Cabral, shares with you exactly how you can reverse aging, take back your health, and live a life full of energy and passion, with new 20-minute episodes every single day to keep you healthy and engaged. Now, here's your host, Dr. Stephen Cabral.
All right, everybody, back with a brand new episode of the Cabral Concept. I think you're going to find this one interesting. It's called the 15 Signs You're Not Nasal Breathing. You might be asking yourself, what does that have anything to do with overall health or wellness or body transformation or longevity? Well, the truth is that humans were meant to eat and speak with the mouth, but breathe through their nose. Now, if you go back to the ancient yogic texts or Vedic texts or Ayurvedic medicine or anything like that, you'll notice that a lot of techniques and a lot of text and literature was written simply about different breathing-based techniques, mainly through the nose, alternate nostril breathing, etc. Well, as we start to move to modern day, so-called modern day science, we understand that breathing through the nasal passages better balances oxygen and carbon dioxide in the body. Why is that important? Well, balancing oxygen and carbon dioxide is vitally important. If we have too much carbon dioxide, we have to increase our breath rate and huff more of that off. If we don't have enough carbon dioxide, then we don't drive enough oxygen to the tissues. And oxygen helps provide energy for the muscles as well as the brain itself. So it's crucial that we balance these, and nasal breathing helps to do that. Now, on the flip side of that, a lot of immune-based properties happen with nasal breathing versus mouth breathing, and we'll be talking about that here on today's show. So I've done interviews with Dr. Jay Wiles, with Patrick McEwen, and I've done also an interview with James Nestor. All of those interviews I can link up here today as well. So if you really want to deep dive on this topic, let's do that. And you can go find those episodes at stephencabral.com/2881 if you want to head over there next. So let's go over 15 signs, though, that maybe you don't know if you're nasal breathing or not. Here's some signs that you're not nasal breathing, at least enough, okay? The first one is this: upper chest breathing. If you can actually see your chest and shoulders rising and falling rather than your belly and rib cage expanding, most likely you are not nasal breathing. Most people who mouth breathe like that, much more taxing on the body itself. So it can be far more inefficient. It is far more inefficient and tiring. Now, if you're sprinting or you're at max capacity in terms of output, will you mouth breathe? Yes, most likely. No doubt about it. But if you're at like zone 1, zone 2 cardio, you can nasal breathe, no problem for most people. Even someone like myself that has a deviated septum. Like the right side of my nostril is barely open. And now it's much better now that I don't have a lot of inflammation in my body. But back when I had food sensitivities and gut health issues and lots of inflammation, if I plugged my left nostril, meaning like if I just pressed against the outside of my left nostril, I could not breathe, legitimately could not breathe through my right nostril. Barely get any air in. So it would cause me anxiety, which we're going to get to as one of these notes here. But just keep that in mind. If you have a deviated septum, work to reduce inflammation in the nasal passages, the sinus passages, and then you can improve your overall breathing. All right. Number 2 is chronic overbreathing. So if your breath rate is greater than 16 breaths per minute, most likely you're not balancing oxygen and carbon dioxide properly, and that could be because you're mouth breathing. More people overbreathe mouth breathing than they do nasal breathing. So just keep in mind, breathing through your nasal passages is typically 3 to 5 seconds in and 3 to 5 seconds out. So that lends itself to about 10 breaths to maybe 12 breaths per minute. Like that's about it, okay? Number 3, greater incidence of snoring and or sleep apnea. If you're someone that has sleep apnea or snoring, you most likely are not nasal breathing at night, you're mouth breathing. And a big fix to that is sleeping on your side and or mouth taping. And I'm going to be sharing the brand new mouth taping brand that I've been using now for about 6 weeks. Best brand I've used to date. And I'm going to do a whole kind of review on that and why, and also why I think it's safer. So look for that in about 3 weeks or so from now, okay? Let's see, number 4 is dry mouth or bad breath. So a lot of halitosis, bad breath, is caused by gut-based issues, but it can also be an overgrowth of anaerobic bacteria from mouth breathing. So mouth breathing overnight, yes, but also just mouth breathing during the day. Keep the mouth closed, tongue to the roof of the mouth. I'll get to more of that in just a moment. If you've gone to the dentist lately, this is number 5, and you've seen more dental decay or gum-based disease, or even inflammation of the gums themselves, gingivitis, etc., it could be that you're doing more mouth breathing and there is more of that bacterial buildup in your mouth. Something important to look for, and also speak with your dental hygienist or dentist. The next one, number 6, is dysfunction of the jaw joint itself. Now, some people have heard of temporomandibular joint disorder, or TMJ. Tightness, inflammation in the jaw itself, the joint right where your earlobe is essentially, or right above, below your temple, right where the tragus is, that kind of fleshy part of the ear. If you're feeling a lot of pain there, it could be mouth is hinged open during the night, sleeping, and or during the day. So just take a look at that as well. Number 7 is narrowing of the dental arch, jaw, or palate. This is often through childhood, with children doing more mouth breathing, especially overnight, rather than nasal breathing. And most of that actually has more to do with the tongue being pressed or depressed against the upper soft palate, which allows for the expansion of the teeth and then the widening or normal widening of the jaw. Number 8 is crowded or crooked teeth. I had very crooked teeth as a child. I had braces for 5 years, and that is most likely from my food sensitivities, my allergies, a stuffed nose where I couldn't breathe through my nose, and so I breathe through my mouth all the time. And most likely, besides MTHFR and other inflammatory issues, it led to my crooked teeth. No longer crooked, but again, that was 5 years of braces. All right, number 9 is teeth not aligning properly. Sometimes this is called malocclusion, or it's called an open bite. But basically, the top set of teeth, the row, does not fit perfectly over the lower set. And again, it goes back to the tongue not spending enough time towards the top of the mouth. But you may have heard this from your dentist, and I wanted you to be aware of that. Another sign that you may not know it, but you're doing more mouth breathing. Number 10 is more potential if you've had braces or Invisalign or any of those things, that your teeth go and they crowd back. They just kind of go back to where they were before, especially the top row. It comes back to that tongue being not at the roof of the mouth while you're nasal breathing, especially overnight. All right, number 11 is a dysfunction of the muscles in the jaw itself, even with the lips. Now, the muscles may make sense to you because if you're keeping your jaw closed and you're breathing through your mouth and your tongue is at the top of the roof of your mouth, you're using those muscles. Great, so that works, especially overnight. But believe it or not, the lips are becoming more flaccid if your mouth is left open all the time. But keeping them pursed together, not hard, but gently, actually works the muscles in the lips as well. Number 12 is eating with your mouth open, noisy eating, or potentially even speech or swallowing based issues. I think that's important to look at that because if someone's looking at you like you're eating very loud, it could be you're eating with your mouth open. That could be one, but it also could be because you're not used to breathing through your nose. So you're not able to eat very well with your mouth closed, with lips pursed together, if you're not used to nasal breathing. So one helps the other, without a doubt. The 13th one is if you've been told you have enlarged tonsils and or adenoids. It could be another sign, again, that you are not nasal breathing. Number 14 is increased levels of stress. May not seem like that's normal, but when you nasal breathe with the tongue touching the roof of the mouth between the teeth, what happens is when you do that, it induces the parasympathetic nervous system. It helps move you out of fight or flight. Why? Because anybody who's not in a threatened state can participate in nasal breathing. If you're in a heightened, anxious state, there's no way. You're getting ready to take in more immediate oxygen, right? And you're huffing off more CO2. And so you're breathing through your mouth in more of an anaerobic heightened state. Okay, good one to look at. That was new to me when I was doing my research. And I thought that was a smart one. Number 15 was increased dry coughing and throat clearing. I wrote this one down because I've seen a number of wellness clients in my practice have a little bit more of a dry cough as they get older. Two reasons for this. One, sometimes they get this when they're a little bit more anxious. There's no doubt about that. But a second reason is that we were meant to breathe through our nose because it's actually a first line of defense for pathogens, bacteria, viruses, dust, pollen, and much more. So when you breathe through your nose, you have tiny cilia or hair. And what it does is it captures all of those, not all of those, but many of the particles, pathogens, virus, etc. And we also have a large amount of mucous membrane that can help bring white blood cells like secretory IgA, SIgA, to the area that can then kill that bacteria or viruses, which renders it not harmful to the body. And then when you blow your nose or you use a neti pot or something like that, it comes out. So it's pretty impressive. But when you keep your mouth open and you're breathing through your mouth, you don't get that same first line of defense. You can inhale the dander or pathogens or dust or whatever it is. And sometimes it gives you a little bit of that dry throat and dry cough as well. Something to think about. So if you are someone with that little bit of a throat clearing or dry cough, and it's not just anxiety based, even if it is, go back to number 14, keep the mouth closed, the tongue raised to the roof of your mouth, breathe through your nose slowly and out slowly. Even if you breathe out through your mouth, it's okay, but you want to breathe in through your nose. And what that will do is help to induce more of a calming state. So those are the 15 signs you're not nasal breathing. Hopefully that was helpful. Happy to take questions in the comments below. And as always, if the show was helpful, do feel free to share this show with anyone you believe it could serve. And it is show number 2881 for all those show notes and details. You can find them at stevencabral.com/2881. Take care, everybody. Are you ready to heal yourself and then go on to heal others? If so, the Integrative Health Practitioner Institute can help you discover proven functional medicine protocols that blend the best of 7 different healing disciplines from around the world. I personally share with you the exact handouts and protocols I use in my private practice that enable people to get well, lose the weight, and live longer, stronger. I want to pass this information on to the next generation of health coaches, and that is exactly why I created IHP. We are the future of the health coaching industry, and the skills and knowledge you will learn will make you an in-demand certified health coach anywhere in the world. Although we have many medical professionals taking the IHP certifications, no experience is necessary, and half our members have no previous health certifications. At the Integrative Health Practitioner Institute, our motto is a health coach in every home. Our goal is that you take this knowledge and then share it with family, friends, loved ones, your community, or in a practice where you create a career you love and can be proud of. The global IHP community is filled with some of the most kind and caring people in the world, and we can't wait to welcome you into our world soon. For more information or to set up a discovery call with one of our IHP Health Coach graduates, simply head over to integrativehealthpractitioner.org.